Mr. McKinnon, 5 minutes.
Thank you, Chair. There have been media reports that law enforcement is still unaware of the Good Samaritan Drug Overdose Act, which became law in the spring, and they've charged people with possession by accident only to have the charges reversed. And everyone who assiduously hung on every word of my member statement earlier in the House will know that today the Canada HIV/AIDS Legal Network and the Waterloo Region Crime Prevention Council released a wallet card and fact sheet funded by the Ontario Foundation of Law, and this information will be provided to people who use drugs, service providers and volunteer organizations serving people at risk of experiencing or witnessing an overdose emergency, and stakeholders in health, social services, government, and law enforcement across Ontario. So, Minister, can you explain what efforts Health Canada is undertaking to promote the provisions of the Good Samaritan Drug Overdose Act more broadly across Canada so that drug users and law enforcement are well informed?
Thank you so much, Minister MP McKinnon, Mr. McKinnon. I have to first of all congratulate you on bringing this bill forward. If my memory serves me well, we had unanimous consent. It passed, flying colors. So we certainly recognize that there's a need, and job well done. I also have to say that earlier on in the year, I was in Kelowna, British Columbia, and I was visiting my first supervised consumption site. And as I was there speaking to the nurses, what do I see is a poster that talks about exactly your bill. So we see that the word is getting out there, and we certainly need to make more efforts to ensure that Canadians are aware of this legislation. So to answer your question, I can say that Health Canada is working with partners, including law enforcement officers, to inform Canadians, not just law enforcement officers, but also work to inform Canadians of this new legislation. And also we've done so by using social media, public spaces, and also web content. So we certainly want to continue the work because it's a really important piece of legislation. And as you've indicated, we truly want to make sure that there's no barriers for people to call 911 if it's about saving a life here. So at the end of the day, we will continue to make sure that our frontline service providers, but not only them, also Canadians at large, are aware of the regulations.
Thank you, Minister. So I'll move on a little bit, stay in the area of drugs. So Health Canada, the Canadian Institutes of Health Research, and the Public Health Agency of Canada are requesting approximately $11.8 million in Sub B to support the Canadian Drugs and Substances Strategy, which will support harm reduction activities, public education, expansion of drug science, monitoring activities, and research. Can you explain why there is a need to expand drug science and how it will be expanded as a result of these funds?
Sure, absolutely. I'm very pleased to take this question. Again, having been in Alberta not that long ago, we were able to meet with many individuals that, especially individuals with lived experience. And we were able to meet with them, and they shared with us, again, their personal stories, the challenges, but also what worked and what didn't work for them. So with respect to the investments that we're making in health research, we really want to look at pilot projects or pilot programs that are happening on the ground, and again, from there to find out what are the best practices. And then from there, if we can learn from those best practices, we may be able to adapt them in other parts of the country. But it's truly important to ensure that we get the data, because if we don't have a scope of the situation, we're certainly not going to be able to effectively deal with it. So investing in research is paramount, and it's certainly a priority of our government.
Okay, thank you. I guess carrying on in that, what proportion of these funds will be made available under the Canadian Drugs and Substances Strategy to support increased availability of treatment options? For the strategy itself, $100 million has been earmarked for the strategy. With respect to the actual breakdown, I may defer that to Mr. Kennedy.
Sure. The additional funding coming in this year for the Drugs and Substances Strategy, we have a program called the Substance Use and Addictions Program, which has funding of around, I think it's $28 million a year. There's additional funding that comes in over the next number of years as part of the strategy to top up that program. The additional funding on top of the existing dollars, which are permanent this year, are $2 million, another $2 million next year, and then ongoing an additional $3 million. So that's extra money through that program we'll be putting out for piloting innovative treatment projects, that sort of thing.
Great. Thank you.
Okay, time's up.